Assalamualaikum warahmatullahi wabarakatuh. Hi everybody. Let me introduce myself. My name is Muhammad Alfarski. You can call me Alfa. NPM 183100093. Nah, I make this video for sharing time about COVID-19. Okay, let's talk about coronavirus disease or COVID-19. Coronavirus disease or COVID-19 is a respiratory tract infection caused by several acute respiratory syndrome or coronavirus or SARS-CoV-2, or what is often called coronavirus. This virus has a high mutation rate and genetic pathogen that can process in human animal with every deserved clinical presentation, ranging from asymptomatic, mild to severe symptomatic, even to death. The etiology of coronavirus or COVID-19 is virus with this species named severe acute respiratory syndrome, coronavirus, to known as SARS-CoV-2. There is risk factor. The risk factor for COVID-19 are not yet fully understood. The main risk factor for COVID-19 are: the first, history of traveling to a country affected by COVID-19. 2. Direct contact with a patient who has been confirmed with COVID-19. There are several risk factors that may increase the risk of mortality in COVID-19 patients include age over 15 years, immunocompromised patients such as HIV, hypertension, diabetes mellitus, malignant disease such as lung cancer, cardiovascular disease such as heart failure, chronic obstructive pulmonary disease, pregnant women, high quality organ failure assigment, and neutropenia. Epidemiological, the prevalence of coronavirus disease or COVID-19 is increasing rapidly worldwide. The World Health Organization or WHO has designated COVID-19 as a global pandemic. The first case of COVID-19 was discovered in December 2019 in Wuhan, China. After that, within a few weeks, the virus spread all parts of China, and within 1 month it spread to all other countries, including like Indonesia, Italy, the United States, and Germany, on all of countries. The first step is in establishing a diagnosis of COVID-19 is by taking anamnesis and assessing the epidemiological risk and the patient contact history. The risk feature: the reserved the transverse polymerase chain reaction, estimates of nasopharyngeal swab, and specimen, and the gold standard for diagnosis COVID-19. History symptoms of COVID-19 generally occur after an incubation period of 2 to 14 days. We can find symptoms: fever, weakness, and dry cough are the most common symptoms of COVID-19. In addition, some patients also experience sore throat, myalgia, dyspnea, and cough with pain. Gastrointestinal symptoms such as nausea, vomiting, and diarrhea can also occur in COVID-19 patients. However, some patients may be asymptomatic or symptomatic. Some cases show severe symptoms such as pneumonia and acute respiratory syndrome distress. Management of COVID-19 depends on the severity of the disease. In patients with mild symptoms, isolation can be carried out individually. In patients with severe disease, of the risk of worsening, care in a health facility is required. Supportive therapy for mild symptoms for COVID-19 patients with mild symptoms, isolation can be done at home. Patients are advised to wear masks, especially when in the contact with other people. Some supportive therapy such as antipyretic, antitussive, and expectorant can be used to relieve the patient's symptoms. The prognosis of patients with COVID-19 generally depends on a comorbidities complication. These complications generally occur in COVID-19. Patients who have risk factor complication, the most common complication of COVID-19 is acute respiratory distress syndromes or ARDS. In addition, several other complications such as septic shock and tuberculosis can also cure. The long-term complications of COVID-19 are currently unknown. Health education and promotion plays a major role in handling COVID-19. During the pandemic, the government has recommended all citizens to apply 3M. The first, namely using mask like this, and then washing hands. We have to washing hands every day. When we are to go everywhere, somewhere, we have to washing hands, or maybe we can use antiseptic and maintaining distance, social distancing other people with good health education and prevention. The level of spread of COVID-19 can be reduced. Disease prevention of control education is one of the public health efforts to prevent the spread of COVID-19. The following are some of education that can be provided to the community. I think enough for saving time about COVID-19. Wassalamualaikum warahmatullahi wabarakatuh. Thank you. See you next time.